Is fibromyalgia an autoimmune disease? This is a question that has been popping up a lot over the last few years. I'm going to tell you my thoughts. Guys, I'm Dr. Jen Caudle. But first, what we should do is just level set about fibromyalgia. Now, first of all, I have an entire playlist on YouTube with all of my fibromyalgia videos, everything from what it is to what causes it, etc. I'll link it here, but let me just give you a very quick overview for those of you who might be new or new to fibromyalgia. So fibromyalgia is a chronic widespread pain condition. Typically affects women in middle age. And it's a condition that's got sort of three main hallmarks. Of course, chronic widespread pain. The pain must have been present for at least 3 months. The pain can either be on both sides of the body, on one side of the body, etc. But in addition to this chronic widespread pain, people with fibro also have fatigue, and they also have poor sleep. Now, in addition to those three sort of hallmark symptoms, people with fibromyalgia also have other symptoms. I'm not going to go through all of them because I have that in some of my other videos about, what the definition of fibro is, how it's diagnosed. But just to give you a taste of it, it can be anything from anxiety or depression, migraines, irritable bowel syndrome, fibro fog, that means feeling fuzzy or foggy, trouble concentrating in the brain, numbness, tingling, sensitivity to light or sound. There's a ton of other symptoms that can go along with this. And in addition to the three I mentioned, chronic widespread pain, fatigue, and trouble sleeping, people also have some of these others, okay? That's a general overview, all right? Now, in terms of whether fibromyalgia is autoimmune or not, I know that in the last few years there have been some studies that have suggested that fibromyalgia is potentially an autoimmune disease. When we say the word autoimmune, what do we mean? We are talking about a condition in which the body attacks itself. That's what autoimmune means sort of in practical terms in the body. So some examples of autoimmune diseases that we have are things like lupus, Sjogren's disease, rheumatoid arthritis, psoriatic arthritis, the ankylosing spondylitis. The list goes on and on and on. And there have been recent studies that suggest that fibro may be an autoimmune disease, all right? Well, it's more widely accepted that it's not an autoimmune disease, but rather fibromyalgia is a disease that has a problem with the central nervous system, and that it's a central nervous system issue. In other words, the way that the central nervous system, that's the brain, the spinal cord, etc., processes pain in people with fibromyalgia, that's what the problem is. And that is according to most associations and organizations, from the Arthritis Association to, the American College of Rheumatology, to so many different organizations. So there are these two different thoughts. And to be honest with you, I believe that our best information right now leads us to believe that this is actually a condition of central nervous system processing, that it's a problem with how the brain processes pain. People with fibromyalgia experience pain at a more heightened sense than people without fibromyalgia. Now, I'm not saying that we may not ever find out that this is an autoimmune condition, but right now, I don't believe that we have the evidence and the data to say that it is an autoimmune condition. Although, yes, it has been proposed in the literature, and some studies have been, sort of suggesting that it might be. I don't think, and I know we're not there with calling this an autoimmune disease. So right now, my thought is this is a central nervous system processing condition, okay? Now, along with that, though, let me also tell you that there are some things that put people at risk for getting fibromyalgia or developing it, okay? Remember, I said that women who are in their middle age tend to be more commonly affected, say, than men or others. Now, men can get fibromyalgia, by the way. And if I haven't said this already, which I know I haven't, please write in the comments if you have fibromyalgia. Write in the comments if you have it, what you do for it, what helps you, because oftentimes what you write helps other people, okay? But let's go a little bit to some of the things that can predispose someone to having fibromyalgia, maybe more so than someone else. Genetics can do it. We think that fibromyalgia may be more likely to run in families than not, okay? Also, people who do have autoimmune diseases, things like rheumatoid arthritis, lupus, etc., may be more likely to then get fibromyalgia. Remember, I don't believe it's an autoimmune disease, and I don't believe the evidence we have says it's an autoimmune disease, but it has been proposed as an option, an etiology option. Okay. The other thing is that trauma can trigger fibromyalgia for some people, a traumatic event, a traumatic episode, something traumatic. Also environmental triggers as well, okay? There are a number of things that can trigger fibromyalgia in different people. And, even though I'm saying that we believe that this is a condition where there's a problem with central nervous system processing of pain, I will also go on to say that there's a lot we don't know about fibromyalgia. There's still a lot of holes. There's still a lot of gaps. There's still a lot of information that we need to know and studies that need to be conducted. And I do believe that every day, every year, we are learning more. In fact, even the criteria that we had for diagnosing fibromyalgia back in 1990 is way different than it is now. So we have made advances, but it is still a condition that troubles a lot of patients. It does take patients multiple doctors on average to finally get a diagnosis. It generally takes patients a multitude of times to try to convince their doctor to believe them. And there still is this bias in medicine against fibromyalgia that there are a lot of doctors who simply either are unfamiliar with it or don't believe that it is real. These are very true and real barriers to fibromyalgia diagnosis and treatment that many patients face. I want to know, by the way, have you had some of these barriers? Has it been hard for you to convince your doctor that you have fibromyalgia, or at least to have the conversation? It's really, really tough. So if you have felt that way, you are certainly not alone, and we do have a long way to go. But the more we talk about it, I think the more we sort of accept it as a condition. And by the way, it is a medical condition. You'll see from the rest of my videos that I have, the videos on unusual symptoms of fibro, how we diagnose it, the treatment criteria. We have 3 FDA-approved medications for fibromyalgia. The FDA does not approve medications for a condition that does not exist, right? Okay, so I mean, this is just further information. But back to the point again, no, I don't think that we're at the place where we can call this an autoimmune disease, and I don't believe that we have the evidence, et cetera, to fully say that's the case, though there have been some studies recently that have said this. The last thing that I'll say is that, and I always like to leave on a moment of hope, okay? There are things we can do. There are great medications. There are what we call multimodal treatment plans that can absolutely help you. Please take a look at my playlist of the different videos that I have. I'm going to keep making videos to try to help you and support you through your journey, but don't listen to other people if they shut you down. Know that fibromyalgia is real, that it is tough to diagnose, and that we are learning more every day. Guys, I'm Dr. Jen Caudle. I'm a practicing family physician, on-air health expert, and video creator. I do daily videos on YouTube. Please subscribe to my channel. Please click the bell to get updates on Facebook. Please like my page. I'm on TikTok, WhatsApp, LinkedIn, Threads, Instagram, you name it. Please follow me there. Also, I have a weekly health. Gosh, I'm tripping over words. I have a weekly health newsletter. It's free. Please go to my website, drjencaudle.com, to sign up. All right, guys. Love y'all.